I'm going to share a little bit about the course MedSci 142, which is quite a large course and quite important to the faculty. As a course coordinator, I don't have a very large role in lecturing per se. So out of 35 lectures, say, I contribute a maximum of 3 to 4 in a team taught environment. So my contributions are mainly restricted to those lectures, as well as some coordinating the laboratory teaching program. So my mission as a course coordinator is to focus on the learning design element to maximize out of class learning opportunities to support the students to achieve in the course. MedSci 142 is a large enrollment year 1 human anatomy and physiology course. Interestingly, none of the content is taught at the NCEA level. So all the school leavers find it really challenging because they're encountering this content for the first time. So unlike physics, unlike chemistry, almost 99% of students have zero exposure to human anatomy and physiology. And that's one of the key reasons why students find it so challenging, yet exciting, because they're learning about their bodies for the first time. It is a requisite course for progression in lots of clinical and non-clinical programs, both for the FMHS and for the Faculty of Science. So it plays a really crucial role in the foundation for the students at university. As a consequence, we have a very diverse student body with different motivations, different levels of baseline knowledge, learning approaches, and how quickly they learn things, and also their time availability. Increasingly, we're seeing part-time students returning from work or trying to juggle work commitments as well as studying part-time. It is a challenging course. In 2019, the pass rate was about 78%. So you can think of the flow-on implications for continuation in the degrees. So as good teachers and learning designers, we always try to achieve constructive alignment by having really clearly stated intended learning outcomes, really good teaching learning activities, and that helped students to achieve their assessment tasks. In reality, however, based on my face-to-face meetings with MedSci 142 students and students' Piazza posts, it is clear that a lot of students do not understand what learning outcomes actually are. I'm seeing a few nods around the room. Students typically express these in ways such as, I don't know what to focus on when I come to lectures. I just take notes on everything that the lecturer says. There's lots of Piazza posts that ask, do we need to know X, Y, and Z? That's one of Simon Malpas's favorite questions, and his answer is yes, always. You need to know everything. And also underpinning all that is students don't really have any clarity about what the learning outcomes mean, although the instructors may think we're being really clear. Related to that challenge is that in year 1, multiple choice type format questions tends to be the predominant form of assessment for a huge variety of really valid reasons. And as a consequence, students often think or believe they understand the concepts well, but they really struggle to express that knowledge in tests and in exams. And some students have also articulated that most of their courses use MCQs, and that's all they know how to answer. They know how to eliminate options. They don't know how to generate the answers. So that's really it's a related challenge that I'll hope to address with these activities that I'm going to talk about soon. But before that, I alluded to this earlier, because students don't know what the intended learning outcomes refer to, they can't keep up during lectures because they're trying to capture every single minutiae that lecturers may be mentioning, and they sort of lose sight of the key points. And as a consequence, they run out of time to actually reflect and study before tests and exams. And some students are sort of clued onto that, they sort of realize how unsustainable that the approach is. And when they make an appointment with me, one of the key things they want to learn is guidance on how to use their study time more efficiently and effectively. So as lecturers, our contact with students are limited to the lecture. And what we should all we're all doing now is recognizing the importance of engaging students before the lecture and after the lecture to maximize learning that happens outside of the classroom as well. So a few years ago, I decided to design activities that are intended to be revision activities that explicitly align with each of the learning outcomes and to give students an opportunity to practice meeting the learning outcomes in a low stakes or no stakes environment. So that's what I'm going to talk about next. So this is a snapshot from our course guide. At the top, you can see a grey box explaining to students these are post-class activities that have been designed to help them achieve the learning outcomes for the lesson. It's okay if you don't get it straight away. The whole point is to figure out where your gaps are so you have time to address them in a timely fashion. Then we have a reminder of what the learning outcomes were for that lecture. And then the activities align with each of the learning outcomes. So here we have the learning outcomes, and here we have the intended learning outcomes and the activity aligning to them. So you can see activity 1.2 aligns with both outcomes 1 and 2. Later on, so this is lecture 3, we know because it's activity 3.1, we start to introduce different ways of note taking for students. So a compare and contrast table, a lot of students don't have any exposure to, a lot of them take notes linearly. So we start to sort of expose students to different ways of summarizing information. And again, this activity is aligned with learning outcomes 1 and 2. And here you can see activity 3.2, we throw in a past exam straight away. And I'll come back to this. The students really pick up on this and they really engage and respond to these because they to these examples and activities that explicitly align with the assessment becomes visible. So a few years ago, like I said, this has been, we've been doing this for a few years now. We published we created a space on Piazza for students to discuss their answers with each other. So we don't give their model answers away. We sort of encourage students to share their model answers and initiate discussion. So as you can see, we posted the activity and then students would contribute the answers and then instructor, Piazza tutor, would endorse the correct answer. And what was really exciting about Piazza was that the tutors could prompt for additional discussion and elaboration and discovery with the students. So here you can see Olivia, one of our past Piazza tutors, asked a question extra for experts. What is each lobe of the brain named after? And then you can see a conversation and an online community starting to build with students engaging with discussing the content. Now and you can see down the bottom, students are asking different questions. So may I ask you a question in the case of premature born preterm babies? So it expands beyond the curriculum and it sort of encourages students to extend themselves. One limitation with Piazza though was once a student has posted the answer, all the other students can see it. So it becomes less sort of a personalized, interactive, self-testing tool. So in 2019, I applied for and was successfully granted a Clear Seed grant, which gave me a little bit of money to enable me to design post-doc activities that are interactive. So not just reliant on Piazza, but interactive for each individual student. And again, my instructional goals is to help make the intended learning outcomes explicit in order to help students to prioritize their note-taking and revision after class, which will help them to keep up with classes better. And at the same time, provide formative, personalized, individualized, instant feedback on their understanding, which will help to identify misconceptions early. And hopefully, I'll explain how I achieved number 5 to encourage ongoing social discussion and debate, because I didn't want to lose that aspect from Piazza. So hopefully this, you're starting to see how this all ties into the challenges that were articulated earlier. So here we're going to jump into a live demo, which is always dangerous. I did have a setup. Great. Excuse me. So this is the platform that currently all the activities are built on. You can see that we have a topic dedicated to each of the, a module dedicated to each of the topics in the course. And because of, oh, thank you. oops. Sorry about that, Zoom guys. Okay, so we have a module dedicated to each topic that's taught in the course, and because of COVID, we've also managed to move some of our lab content on interactively onto this platform as well. But let's pick a topic. And for each topic, we have the learning outcomes and the activities. So students would engage with this, and if they type in any answer, they can double check their answer with a sort of a guided feedback that they can either sort of affirm or sort of challenge their current understanding. Now, like I said, this is nothing revolutionary. A lot of courses do this, but what has been interesting is that a lot of courses provide this as sort of post-class MCQs, like Canvas quizzes. And again, that feeds into the whole MCQ focused mode of learning yet again. And in anatomy, there's a lot of labeling diagrams, lots of annotating diagrams, not just labeling, lots of flow charts for physiology, which Canvas quizzes are not really fit for purpose as a platform. So as we'll see in the student feedback, that students pick up on the fact that having different modes of activities is important, and MCQs as a quick feedback has its limitations. Later on, you can see that there's flow charts that students have to work through to figure out whether it's positive feedback or negative feedback. And later on, we have a interactive flow chart describing the process of the formation of the female and male genitalia. And later on, a sequence of events for female and male development during puberty, and later on, a discussion on menopause. So that's the platform. So a lot of, as you can see, each of the activities are explicitly aligned with a learning outcome. So how did students respond to this tool? In 2019, our set response rate wasn't great. It was 12.8% participation rate. But in the open-ended comment section that asked students what was most helpful for your learning, Kura Cloud, these post-class activities appeared 37 times out of 107 open-ended comments. So that accounted for over a third of the open-ended comments that we received as being helpful. So remember, there's no sort of prompt specifically inviting students to comment on this. So this is just impromptu comments. So I've picked 3 quotes there. Students were able to complete the questions for all the lectures. They found the activities so helpful in consolidating what they've learned. Being interactive instead of just reading, they found it more active learning, very helpful to help them practice and stay focused. And immediately assess their understanding and figure out where the gaps are. So the learning intentions were achieved. We then held 3 different student groups, focus groups, to capture more nuanced comments. And what emerged from these student focus group interviews was that students use Kura Cloud very differently. And not surprising really, considering the size of the class, 1,300 or above. Some students, a lot of students use it straight after they've done a lecture. Some use it after they've written up the notes to check their understanding. But some students said that they started using this before class as a way of priming themselves. And I'll come back to this because in 2020, during COVID, this has actually become a really important part of how some students have been able to keep up with the course better, and also how I've been able to help the struggling students who are struggling with the workload to help prioritize their learning. So I'll come back to that very shortly. Some students you do every single lesson religiously, and some only select topics that they struggle with. Some students have recognized that by engaging with this routine, they were starting to build habits that they were able to transfer to other courses as well. Students recognised that the activity types are fit for purpose for this course. So we weren't limited to just multi-choice questions. Their students were challenged to use drop boxes, labelling, annotating actual diagrams, etc. And they really enjoyed the active learning aspect. They were doing things they felt they were doing. The students appreciated the explicit alignment with the learning outcomes and the assessment as demonstrated by linkages with past exams. Students felt they could just have a go without any risk. They weren't being judged, and they made the real exam seem less scary because, you know, in students' minds, exams like, you know, you pass or fail, whereas just having a go in practice that made it less challenging, less daunting. Some of the model answers we provided, which acted as useful signposts of signaling to students their progress, but some of the activities we didn't give model answers for, and all we did was in the model answer section we said share your answer on Piazza, and that's how we got students to really engage, stay in touch with other people and debate about, you know, questions or activities that didn't necessarily have a right or wrong answer, to continue that Piazza interaction. Students felt that the use of these revision tools helped to complement their lecture attendance. It allowed them to self-monitor their progress. It promoted deeper learning and helped them to begin to summarize key concepts in a more accessible manner. That helped them to see how what they were taught in lectures could be applied in different contexts, different ways of testing the same understanding, using different diagrams, different processes, but nonetheless testing the same underlying knowledge. There were a few comments about, it started making the students think like lecturers, and they started sitting through lectures and go, oh, that could be an activity. I can see myself being designing an activity based around this idea later on. So students were starting to pick up design elements of how they could turn a lecture segment into a question. The affective domain of learning is also really important. Students, through the focus groups, it was really became really clear that they felt good and affirmed when they got the questions right. And, you know, there's a gamification element there as well that made the revision fun. And also the sense of clarity as well. When they get things wrong, it can feel demoralizing, but at the same time, they recognize that they'd rather know than turn a blind eye to their blind spots. And also they recognize that because they're exposing themselves to these assessment type questions now, they recognize that they won't feel as overwhelmed or anxious by the time exams actually hit. Interestingly, I didn't expect this finding. Students, you know, on exam base, there's tons and tons of past exams available, but students weren't printing these out and doing them because they want to save paper or save money, because printing costs our students money. And so a lot of students were just, they're aware of the presence of these past exams, but then they weren't accessing them or doing them. So now, because we've integrated some of the past exams into this digital platform, they can type out their answers without having to print. So that's an interesting finding from these focus groups. And some students, they wanted the activities as Word documents or PDFs they can type as well for the same reason. So we've responded to that and converted all these online activities into it's just a screenshot of the website, but nonetheless students love having a local copy they can do at their own pace. So that was last year. And then of course this year we have a very interesting learning environment. So whereas previously these activities have been designed to be used as revision tools, this year these activities have proved to be an invaluable resource in helping students to become really clear about what the learning outcomes are, to prime their minds for learning, for engaging with the lecture recordings, and to most importantly, help them to decipher what to focus on and prioritize in their online learning environments. So coming back to the demo. Our learners, some of our learners have really struggled with the online learning aspect of 2020. They've sort of lost the cues that they normally get from their peers, from the lecturer in the live setting about what is important and what's less important. So I've had lots of Zoom meetings with students over the COVID period, helping them to sort of keep on track and keep up with the work. And what I found myself saying to them is referring to these activities on CurriCloud and getting students to just spending 5 minutes before they watch a recording to preview the post-class activities. And I likened this to a movie trailer. You know, it's a sneak peek into the future. And that analogy has worked really well for students to sort of capture the key plots and plot twists of the lecture they're about to watch. So for example, activity 14.2, the keywords I asked the students to identify after reading the question are gonadotrophs. What are they? Where they're located. So when they come to view the lecture and the lecturer talks about gonadotrophs, their attention will naturally be elevated towards these. Here is a diagram that the lecturer actually uses in the lecture. So I said, you don't have to understand this image right now, but just by seeing it now, when the lecturer is talking about it and explaining it, you won't be encountering it for the first time, and you know to pay attention to it because you know there's a post-class activity focused on this. So I mean, it's nothing dramatic or sort of revolutionary, but just making this more explicit to first-year students has really helped a lot of these students who struggle with online learning to give them a bit more direction. So the same can be said to this flow chart. It's a modified version of the PowerPoint that a lecturer uses, and it just helps to make it explicit that when it's aligned to the learning outcomes. So when the lecturer is talking about it, you should pay more attention, and so forth. So just by that simple step, I get the sense from these meetings with students that there's a huge sigh of relief. They now know how to streamline their lecture watching and note taking in a more effective way. And yeah, so I've caught up with a few of them after had follow-up meetings with a few students, and they seem less anxious and less behind in their work, but you know, that's N is very small. But nonetheless, it's nice having a tool to actually try to address some of these challenges of online learning. So I asked a few weeks ago about, from this year's cohort, about their feedback on the post-class activity. So I'll give you a moment to read this. I won't talk. Great. And finally, so the final feedback caught me by surprise. You know, CurriCloud will help you grow mighty Kauri. It really is, you know, helping these first year students transitioning out of high school to be able to focus on the big picture and before delving into the details. I think by making intended learning outcomes more explicit and meaningful to the students, I think we've really sort of made that linkage a bit more helpful. So in summary, students, despite our belief that our intended learning outcomes are clear, they do need explicit examples of alignment and help to practice. These activities have had unanticipated utility, especially in times of crisis. But at the same time, there have been students that I still haven't been able to reach. So I guess it's an ongoing question about how do we make it even more accessible and more common knowledge, and how do we help students to see the value and engage with it. And I'm very happy to continue the conversation after that. Thank you.
I think what we'll do is we'll save questions and conversation till after Phillipa's talk as well, so that we can, yeah, have more of a discussion all in one go, if that's okay with everybody. So thank you very much, Angela, and I'd like to welcome Phillipa to join us with your talk about humanities. Thank you.
Kia ora koutou. Thank you for having me, and welcome to everybody on Zoom as well. So I wanted just to spend a little bit of time talking about the medical humanities and the role that they play in the medical program, and give you a little bit of a potted history of what we've been doing in the program for the last 15 years or slightly more than that. And then talk about, I guess, why I think the humanities is really important and why we need to hang on to it. But I want to begin by reading just a little brief excerpt from an essay written by Dr. Glenn Colquhoun, who is a GP down on the Kapiti Coast. And it's entitled, "Why is any of this important to me anyway? Some thoughts from a poet doctor." I started writing poems about medicine because I kept getting stuck as a medical student. There is a language associated with medicine and a way of presenting knowledge that is venerated. And I suppose I got sick of these. It felt as though doctors wanted subjectivity scrubbed out of their language like a bug. Cleanliness was more valued than the vernacular I loved. Randomized control trials, papers by so-and-so, meta-analyses by this journal or that journal were quoted the way the Bible had been by the ministers of my youth. And they had done me no good at all. And so I rebelled. In my first year as an intern, I made a bargain with whatever devil runs medicine. I said, "I'll stay until I finish a book of poems and then let me go." He said, "Okay." We shook on it, but by the time I had thumbed through what I had written, I realised I was hooked. The stories were charming and powerful and immediate. I needed them. Medicine was studying English, playing a sport, and going to church all rolled into one. The poem I want to share with you sums up for me the dilemma I faced as a junior doctor when I was writing Playing God. It was a time of great doubt for me as I struggled to come to terms with the ambiguities of medicine and the fear of making wrong decisions. I had thought that by the time I finished medical school, I would have learned enough not to worry about such things anymore, but found to my horror that I hadn't. I have since realised that these doubts never cease, and in many ways are one of the greatest gifts of medicine to those who practice it. When I am in doubt. When I am in doubt, I talk to surgeons. I know they will know what to do. They seem so sure. Once I talked to a surgeon. He said that when he is in doubt, he talks to priests. Priests will know what to do. Priests seem so sure. Once I talked to a priest. He said that when he is in doubt, he talks to God. God will know what to do. God seems so sure. Once I talked to God. He said that when he is in doubt, he thinks of me. He says, I will know what to do. I seem so sure. One of the points I wanted to make is that a large part of my day has nothing to do with the medicine I learned at medical school. Instead, I often end up talking to people about their sadnesses or griefs or unmet needs. Very often, patients strain at that gap between the way they thought the world was supposed to work and the way they now find it. When people begin a consultation by saying, "Hi doc, I'll only be 10 minutes," I know there is a strong chance that a quarter of an hour later they'll be sobbing. At the end of the day, we all struggle with making sense of who we are as human beings. And in some ways, general practice has become a secular priesthood dealing with some of those questions. And I think what Glenn does just so eloquently is really highlight that uncertainty that comes when he was a medical student, and some of that uncertainty that has continued for him as well. So I began teaching the medical humanities back in 2007. I had come from a background in philosophy, so I had done my PhD in philosophy, particularly in medical ethics. And I came into the program when Dr. Val Grant was coordinating the program here, and then the opportunity became available to apply for Val's job, which I was very fortunate to get. And so I took over the coordination of the program in 2009. And it has been an amazing experience being a part of it. And in fact, I can see Anya's here today, Jan, Tanisha, Marcus, and others on Zoom who are involved. Nira, I can see you there as well, have been involved in the program over the last 15 years that I've been involved. So what I wanted to do, I guess, is just talk to you a little bit about what the medical humanities is, and something about the program that we offer here in the medical program. So what is the medical humanities? Well, I guess there's a lot of really dry and boring definitions, but essentially I see it really as an interdisciplinary field that includes the humanities and the arts, and really their application within medical practice and medical education. And it aims really to provide our students with a different way of thinking about what it is to be human. So what is it to be vulnerable, to be grieving, to be joyful, to be thinking about one's own mortality, to be isolated, to be away from whānau, to be contemplating things that possibly you have never had to contemplate before. And I think what the humanities does is it puts different kinds of lens on the medical endeavour. So we're thinking here, I guess, about a spiritual lens, maybe a legal lens, a cultural lens, a psychological lens, a social lens. So in the humanities, what we do is bring together a number of experts in the field that they have trained in to think about the medical endeavour and to put, I guess, a different way of thinking about what it is to be human from that particular lens. So the goals of our medical program really, I guess, at the heart of it in a nutshell, is to think creatively, to be asking questions, to recognise patient stories, that they matter, that it's not just about the condition. That in terms of the sciences, students can sometimes lack confidence in dealing with the unknown, and yet often in the medical endeavour, the unknown is very much what you are presented with. That's the reality of medicine. In terms of our program, it started actually nearly 30 years ago. So in the early 1990s, a number of people from the arts faculty and also up here in the medical faculty really got together to think about how the arts could contribute something into the medical program that thought about what it was to be human from perhaps a wider perspective, and to gain more insights into what it is to be unwell, but also to, I think, be more effective in that communication between science and medicine as well. But also it had to be something, it had to be an endeavour that wasn't just doctors who wrote poetry or doctors who wrote narrative coming and talking about what they did. It had to be very much based in the rigour and the science of the discipline. So it was really around promoting and encouraging a scholarly kind of interface between the sciences and the humanities. So in 1996, the year 2 students in the medical program had the opportunity to pick some elective arts courses, and they would go off down to main campus and do those for a semester. So this was for 12 weeks over first or second semester. And it continued that way for about 3 years, but for a whole variety of reasons, it wasn't entirely workable. Students, as they do, had a way of working out very quickly what humanities courses require the least amount of work, and so often there'd be a huge influx of students into those particular courses. And it became clear after discussion with the students and talking with those who were working in the field that actually what we needed to be thinking about more was a bespoke kind of program. And so that really started in 1996, and it moved into year 3 of the medical program. So at that point in time, there were around 8 courses being offered, and classes had about 14 or 15 students in each class. And these were undertaken and developed by people who were experts in their field. They were specifically for the medical students. And that has continued actually until today. So in 2020, there are 15 courses in the Medical Humanities program, except our class numbers have gone up. So we now have around 18 to 20 students per class. I think there are a lot of benefits to having small classes. So in the medical program, many of the classes are of the whole year, the whole cohort, so they're big classes, I think, as you're saying, Angela, and in the foundation course, you know, they're 1,300 students. So in the humanities, students actually get a chance to get to know each other. And students said to me, this is the first time that, you know, you have called me by name, somebody has called me by name in my class. So I think there's a lot of benefits to having small classes. These aren't necessarily just the case in the medical humanities. The small groups certainly have that as well. But it's been a real strength, I think, of the humanities that the students get a chance to really get their teeth into a course. In small classes, they have a lot more time one-on-one with the lecturers, and they get more than just a taste of the discipline as well. So they're not taking, for instance, the history of medicine or spirituality of medicine or the law of medicine for 3 or 4 weeks and then moving on to another topic. So we've been quite careful to keep the courses for the 12-week period, so the students really do get a sense of what spirituality or theology is with a particular lens on medicine. So this is a list, not a particularly full list of the humanities disciplines involved, but these are the ones that have been within our program over the last 15 years. Some of them come and go, so sometimes people will run a course for us for 2 or 3 years, and then for a variety of reasons that course may stop. Somebody else might pick it up or change it, or it might undergo a whole evolution and become a completely different course. But this gives you a sense, I think, of what humanities disciplines are involved. And I'd love to spend a bit of time talking about some of our actual courses, but there isn't the time to do that today, but very happy to talk to people more about that. So why is the medical humanities in the medical program? And this is the question that I talk to medical students about. So I meet with them usually at the end of October, and one of the first things I do is say, well, you know, you are sitting here to be doctors. What kind of doctor do you want to be? And I get the students to give me some feedback about that. And often those questions sort of morph into, I guess, a discussion around what medicine is per se. And of course, it's not a new thing to say that medicine is more than science and that patients are simply more than their condition. And yet often, you know, I will hear even in the year 5 students say things like, they will write about, you know, a cancer patient or a patient on ward, whatever, so that the person in a sense somehow gets lost and their condition becomes who they are. There is also, of course, the changing role of doctors, and we've seen that tremendously over the last couple of decades, and the changing expectations of patients. Very much over the last 40 or 50 years, there has been a rejection of paternalism alongside a move towards patient-centred care. Patients now have access to their medical records that they didn't used to have, and patients can also, and are expected, I think, to take much more of a role in determining the kind of healthcare that they want. So according to the Bill of Rights, of course, patients can refuse any kind of medical treatment, even if that refusal causes them to die sooner or later. And of course, we are seeing the way in which some of that discussion has changed over the last wee while with the referendum coming up on the end of life choice bill, which is timely. I think this is a discussion that's been coming for probably the last 20 years, I think, has been leading towards that kind of that decision, and it's going to be interesting to see kind of where we as a society sit on that particular issue. Of course, more recently too, there has been the move more towards e-technologies and telehealth. And I guess an example of that is the medical device industry now, where patients are, I think, in the future going to be expected to take more of a responsibility in terms of managing their chronic conditions over the longer term. So medicine is certainly changing. And I guess alongside that, and combined with the medical humanities, is a need to consider what it is to be human from a much broader perspective than simply the biomedical model. I'm just going to finish with a poem that was written by one of our students, and it's in Tanisha's book that she published a couple of years ago. And I think when I say that the heart of medicine lies human activity and relationships, I think this poem really sums up for me that really beautifully. I met a man today. I met a man today. He is old and I am young. He is dying, I am well. He is lost, so am I. I met a man today. I held his hand. I felt his pain. Tears rolling down his writhing, broken body. Screams of anguish, confusion, desperation. His body fighting, his eyes empty, part of him already gone. His body missed the memo. He gasped for breath, body shaking. His arms snapped outwards, a pale blur. My arm exposed, fingers squeezing, nails sinking deep. His strength takes my breath. One last try. I can see it in his face. Why will she not help me? The sharpness of pain feels odd, far away, detached. The heavy aching in my chest is not. My words of comfort no one. I met a man today. It was not peaceful. It was not quick. His family gone, his nurse too busy. Just sit with him until he passes, and then come and join us on ward round. Thank you. I'll leave it there. There's a lot I haven't said. I'm just aware that it'd be nice to sort of have some questions, and Angela, I'm sure people have questions for you. So maybe we can open it to questions.
Wow. What a note to end on. I mean, there's 100 odd poems in that book. Oh, yeah, go.
Facilitate, yeah. Stop sharing.
Yes, stop sharing.
Oh, sorry, yes.
Okay, thank you both.